Maintenant, qu'il est mort,
The elephant calf is dead, so the other elephants want to know what happened.
qu'est-ce qu'il y a? Si c'est un individu qui
If it belonged to their family, they would push it a bit, hoping it would wake up and get back on its feet. But it's not a member of their family. I think they're just curious, smelling it and so on.
L'odeur et tout.
We carry out necropsies to understand what caused an animal's death, because it could have died from a contagious disease.
Une maladie contagieuse. Un éléphant peut être porteur de
An elephant can carry many different pathogens.
Mais ici, nous avons déjà découvert des carcasses.
We've already found elephant carcasses here infected with anthrax. Anthrax is a zoonotic disease that can be transmitted to humans. If we don't contain it from the very beginning, it can spread.
Ça peut se répandre, ça peut.
This region is a biodiversity hotspot. Many zoonotic pathogens have already been found here. We've detected cases of mpox, Ebola, and Marburg virus disease.
Ebola, il y a Marburg. Depuis que j'étais né,
ever since I was born, I've wanted to help people who are suffering, people who need help. I don't want diseases to spread between species. It's a big responsibility. It's to protect not only our local community, but also people on a regional and even global level.
Sur le plan régional, sur le plan mondial. Nous sommes en train de faire l'extraction.
We are extracting genetic material from the samples we collected from the elephant carcass we found in the forest.
Sur la carcasse d'éléphant qu'on a trouvée en forêt.
It most likely died from a disease.
À cause d'une maladie.
Here in our lab, we're testing for anthrax, mpox, Ebola, and Marburg virus.
Le mpox et Ebola, Marburg. Au niveau des aires protégées de Dzanga-Sangha,
in the Dzanga-Sangha Protected Areas, the support we receive from the Helmholtz Institute for One Health takes many forms. For example, our students can go to Greifswald, Germany, to conduct research there.
À Greifswald, dans cet institut.
One of the zoonotic pathogens that caused us the greatest problems in recent years is, of course, SARS-CoV-2. It's highly likely that the virus originated in bats and was transmitted to humans via an intermediate host. This has not been conclusively proven, but all the solid evidence points in that direction. That means every preventive measure on the ground, every effort to stop further transmission helps prepare against a pandemic. Once a pathogen is spread around the world, as we've seen with SARS-CoV-2, we can no longer contain it. We can try to fight it, but we won't be able to eliminate it.
On est en train de monter
We're putting up a net to catch bats.
pour pouvoir capturer des chauves-souris.
This way, when the bats leave the cave, they'll fly straight into the net. We remove them, collect our samples, and then release them.
Et puis on les libère.
I'm taking the bat out of the pouch. I have to be very careful because if I don't hold it properly, it might jump away and escape. We're only collecting samples. These animals are very sensitive. If we keep them for too long, they can die. So ideally, we work as quickly as possible and then release them, because they're already stressed enough.
Yeah, I have blood from the back. Yeah, can touch. Okay.
Bats can carry many different pathogens, including coronaviruses and filoviruses that can cause diseases such as Ebola and Marburg. The purpose of our surveillance work is to find out which pathogens the bats living in the Dzanga-Sangha Protected Areas may be carrying. Bats live in habitats that people also use. Fruit bats feed on fruit that humans and other animals may also eat. They leave behind droppings in urine which can contaminate other non-timber forest products that people consume. Contact can be direct or indirect. And in some communities, people actually eat bats.
Parce qu'il arrive aussi qu'il y ait certaines communautés qui mangent la chauve-souris.
Around the Dzanga-Sangha Nature Reserve, meat from wild animals is the primary source of protein for local people. The problem is that livestock farming is not well developed in the region. To win the fight against zoonotic diseases, we need to involve hunters and the women who sell meat in the markets. We want to convince them to let us collect samples at bushmeat markets and in the forest. They encounter this meat every day, making them our most important point of contact. The meeting with the hunters and the women selling bushmeat at the market is intended to raise awareness. The animals they handle in the forest may carry pathogens even if they show no visible signs of illness.
Fabian
Leendertz is the director of the Helmholtz Institute for One Health. He's always available if we need to call him, even via WhatsApp. He's very open to sharing his experience. He has worked extensively in the field and he shares that experience with us.
Hello, can you hear me?
Yes. Good morning, Fabian.
Hi, how are you?
I'm good, thank you. And you?
Good.
We already talked with the Hunters organization, so we will have a meeting on Saturday. So we are going to inform them about the InfoBio project and our wish that we want to collect also the sample, like the bushmeat samples, and if they agree on our project and if they want us to collect the samples. So we want to inform them And yeah, so I don't know if you have some advices to give us the way that we will talk with them and so on. Yeah.
But if we know what kind of pathogens are found in the different animals, we can then discuss with the hunters about these animals. Is it an animal where they thought it was not so fit and that's why it was easy to hunt? And once we have that, we can link it to the story where a hunter got sick because he was handling an animal which already they thought that this does not look so good. So it's important to build on the local knowledge, but then add our lab data made in Bayanga and plus later here in Greifswald. That's the basis for evidence-based prevention. We know in Congo Basin, DRC, and Central African Republic, we have a local spillover events of mpox, monkeypox virus from the reservoir to people. And according to the data we published together, it's always the same type in Bayanga, and the villages around. It's always very similar. So what would be your hypothesis then? Where does it come from? How do people get infected?
People said that they ate squirrel, and after those squirrel that they ate, so they developed the disease.
Net hunting is how I support my family. Selling the game allows me to buy soap and other necessities for my wife and children. Net hunting involves a lot of people. We form a circle around the animal so we can catch it.
Oh, go! Yeah.
In the past, there were far more animals in the forest. Today, they're hunted with firearms and caught with wire snares. The animals that remain have retreated deep into the forest. If we know which pathogens are circulating, we can protect the population through awareness campaigns. And if we can identify the reservoir of a disease, we can also warn people about what they should and shouldn't touch. Has anyone from your village come across any animal carcasses in recent days? The forest is huge. Honestly, I don't know. It's possible that someone found a dead animal. The problem is they don't tell us about it. They eat it in secret, even if the animal is sick. Under no circumstances should you touch a dead animal, even if it hasn't started decomposing yet. Understood? When I started at the university and learned about zoonotic diseases, I thought that even if I couldn't work directly with people, I could still help save lives by preventing diseases that are transmitted between animals and humans. Every day brings something new, and I really enjoy that because no 2 days are the same.
Excusez-moi, oui, mais bon, c'est déjà... Ah, ben voilà.
The disease we encountered was mpox. We've had outbreaks here twice already. There were 5 children between the ages of 4 and 9. The other patients were adults. There was also a pregnant woman. At first, people were afraid to reintegrate into society. Even in their home villages, they were stigmatized because of the lesions that covered their entire bodies. Their homes were even ransacked. Their belongings were gathered up and sent after them.
In the Dzanga-Sangha Protected Areas, and in the Central African Republic in general, mpox is endemic. That means isolated cases occur within the community. Whenever such cases are reported, we continue searching for the animal reservoir.
Oh, plein.
Yeah, d'accord.
You feeling better?
I'm well.
Good to hear. Your family?
Doing well too. When my family and I came down with mpox, we were taken to the hospital. We developed lesions all over our bodies. My wife told me that earlier an acquaintance had brought a porcupine back from the forest for food. I don't know whether they had hunted it or found it dead in the forest. Our house was damaged, which is why we still haven't returned to the village. But the people there were told that we've recovered and that they shouldn't harm us. After an experience like that, you become more cautious. Before we eat meat now, we always ask exactly where it came from, whether it was hunted or whether someone found it as a carcass.
Environnement. Une émission de la radio Njoku.
Good afternoon, ladies and gentlemen, and welcome. As always, we're joined by a guest to discuss issues relating to nature. Today we're talking about the One Health program, which focuses on zoonotic diseases, that is, diseases that can be transmitted between animals and humans. Our guest today is Frédéric Singa, a veterinarian working in the Dzanga-Sangha Protected Areas. I'd like to ask you about an important meeting taking place next Saturday. The aim is to bring together hunters, bushmeat vendors, and bushmeat transporters.
We'd like you to vote on a new project. We want to begin taking regular samples from the bushmeat sold at the market. Where are you heading now?
We're looking for our colleagues. They left early this morning, found the gorillas' nesting site, and followed their tracks.
They found the gorillas.
Not yet.
You're still in contact?
Yes, they're still following the gorillas' trail.
We're investigating zoonotic pathogens of all kinds. My passion is protecting human health, but also the health of wildlife.
La santé humaine, également la santé de la faune.
We're with a habituated group of gorillas. In other words, animals that are used to the presence of people. Genetically, they are very close to us. That means they can contract many of the same diseases we do, and those diseases can be fatal for them. That's why we wear masks.
Ils sont comme le reflet.
They're like a reflection of the forest's health. For us, they're like sentinels because they encounter many other species. We regularly collect fecal and urine samples as well as samples from the fruit they eat to see how healthy they are.
Pour une idée sur leur état de santé.
Because we're inside the national park, human activity is prohibited, except for visits by authorized park staff. Unfortunately, poachers don't protect themselves when they hunt. They don't wear masks, and sometimes they get very close to the animals they encounter. That can become a factor in disease transmission.
Ils se rapprochent un peu plus de... ça peut être des facteurs de transmission de maladie.
On a formé des éco-gardes.
We've trained eco-guards to take swab samples from carcasses that our One Health team can't reach.
Pour nous, équipe du One Health.
My name is Janita Abukar. Tell me, have you ever found animal carcasses in the forest?
Yes, quite often. Monkeys and elephants.
What do you do with the carcass?
We stay away from it.
Which animals did you hunt?
Monkeys and forest antelopes.
When did you go and come back?
We spent 2 days in the forest. We got back today.
From where?
The Makupa area.
Makupa. Did anything happen in the forest? Were you attacked by elephants?
No, we came back safely.
Ever heard of diseases that go from animals to humans?
Yes, but we've never encountered anything like that.
The inspection shows everything's in order, so I'm giving you your weapons back. You can go.
We've invited you to this meeting because we'd like to present a new research project. Whether it goes ahead is up to you. You'll decide by voting on it. The aim is to improve surveillance of zoonotic diseases so that infected individuals can be identified, isolated, and treated more quickly. To do that, we need to collect as many samples as possible from animals that are hunted and sold at the market. We'll analyze those samples in our lab, which takes some time.
If I come back from hunting and you take a sample from my bushmeat, what's in it for me? I think you should pay us. A lot of my colleagues feel the same way. Maybe $10.
In principle, I support the project. But what happens if you find a disease in one of the animals? Will you take it away from us? A sick animal loses its value because no one will want to eat it. That's what people are afraid of. You should take the hunter's concerns seriously.
I've never heard of a project to prevent epidemics that pays people to take part. Remember that one day Bayanga could benefit from vaccines developed thanks to this project.
We have just over 160 people here today. Let's vote. Everyone in favor, please raise your hand. A total of 129 votes were cast in favor of the project. Only 16 voted against it. The research project in Bayanga has been approved.
Thank you. I'm really happy that with a short presentation, I was able to convince people to support a project that will benefit everyone. It will benefit the community of Bayanga, the people of the Central African Republic as a whole, and ultimately, the entire world. When you're passionate about what you do, it never feels like a burden. You do it with joy, and you're happy when your message resonates with people. You're happy knowing that, indirectly, you're helping to save lives and support people. That's what matters most to me.